Vaccine passports from September. Nightclubs, we're told, and other crowded venues. Give me more examples.
Well, it's anything that's where large numbers of people come together that we're encouraging to use a certification showing that. So we want people to do it voluntarily if it's big comings together, because we want to stop the spread of the case numbers going up immediately. But we will be looking at this and working out how to operationalise it, making sure that people can use it smoothly. But the message is, at the moment, is get your vaccination. 85% of adults have had their first dose, and we're really keen to have that last 15% of people vaccinated as well, so that we can really come to the end of this transmission of the disease.
Yeah, my question was, give me more examples, sir, of areas where you will have to have a vaccine passport. For example, will you need to have it to go to a crowded pub?
No, we're not saying crowded pubs at all. We're not ruling anything out, but we're not saying crowded pubs. We're saying nightclubs and also larger ticketed events as well. That's where we're looking at.
Some pubs can be as busy as a nightclub.
I think this is the difficulty, to be fair, and we've got to work on the definition. We've got to define it really carefully, and we'll do that in the coming months until we get there. For that reason, because what we're after is we're trying to make sure that, I mean, even nightclubs, they're very different types of venues. You get some big warehouse type venues, and you get some very small rooms with a lack of ventilation, because it's all about ventilation, and that's what we're working on. But we'll work on that over the next few weeks alongside nightclub operators. I was speaking to some last week, and I know they're disappointed this morning, clearly, because they want us. They will be open last night. They want to be able to open and be able to return to profit because they've been so hard pressed. But this is the right thing to do to make sure that we can really get on top of the transmission of cases.
So, sporting venues?
There are a number of sporting venues that are already looking at voluntarily doing this. So you'll see this come into place well before September.
It's really, I'm sorry to interrupt you, but it's really important. It's really important for my viewers this morning to know what they can and can't do. You are representing the government this morning, and you, as a representative of the government, are telling us that we have to have a vaccine passport from September, but you can't tell me where for.
Now, what I'm saying to you is that we are looking at having nightclubs and other large ticketed events when people are coming together. This will be in September, so we'll work on the details over the next few weeks. It's got to go through parliamentary scrutiny, so we've got to get it absolutely right. We've got to work with the sectors that are going to be affected to make sure that we can define this really carefully. All we're doing now is giving an advance warning of what is coming down the line to make sure that the NHS doesn't get swamped and overborne with cases over the winter. But we'll work on that detail with the sector, and we'll give you plenty of notice.
Well, they're seen as super spreader events, that according to Patrick Vallance. If they're seen as super spreader events like nightclubs, why are you waiting until September?
Because we've got to get the detail right, and what we're trying to do is get people vaccinated now. We're trying to encourage people. As I say, 85% of adults have had their first dose, 65% have had both doses. We're encouraging people to get to get vaccinated. But it's right that we actually stop mandating as much stuff as we can from the government and let the economy start to bounce back. But clearly, there's still going to be challenges. You don't. This isn't a film that you kill the baddie, you get to the end, roll credits. We're still living with COVID, and that's the pressures that we're going to have for some time.
We've got a lot to get through this morning. A lot to get through. So basically, what you're saying is that you're using it as a bribe to get young kids to go and get vaccinated ahead of September.
No. What we're saying is that we want to keep people safe. We want to stop the NHS being overwhelmed by cases throughout the winter. We know that the winter has particular pressures, and so that's what we have to face. We're still living with COVID.
OK. Are you completely comfortable, as a member of the Conservative Party, of having what amounts to an ID card by another name?
Look, I'm not comfortable that the government is mandating anything, frankly. I'm a very libertarian conservative. I want to be able to back off, and that's why yesterday was an opportunity for government to back off from so many different things and let people live their lives. But what we have to do is make sure that people can also live their lives safely. The NHS can function safely, and these are the challenges that we still have to do. So it's incredibly frustrating. It's incredibly complicated to work through the detail, but that's the challenge we have.
Don't understand why you're not introducing it straight away then, if it's not a bribe for young people to get vaccinated. Why are you waiting until September? I don't get it.
Because we need to look at, as I say, the detail behind it as well to make sure that nightclub operators and other event operators actually can know how to operationalise the detail to be able to work it through on the door. We've got to get the technology right as well, and we've got to make sure people can fully understand what's coming. But in the meantime, we're encouraging people to use it and operators to use it voluntarily. And I hope that some nightclub operators and event operators will be using it voluntarily to keep people safe within their venues.
You've had 18 months. These nightclubs have been shut for 18 months. Why didn't you do it before now?
Well, 18 months ago, we didn't even know what we were facing. So I'm not sure we've had 18 months to do it because we've only just really worked through how it was spread or the aerosols that were there. What we've been encouraging nightclubs to do is, and I know loads of nightclub operators already do this, is make sure that they're increasing their air changes in their venues because so much of it is about ventilation. And as I said, you've got a lot of different types of operators, a lot of different types of venues. So when you're trying to bring something in that can actually work with hospitality venues across the board, then it is difficult and it is frustrating around the edges for some venue operators.
OK, so there's lots more to talk about with that in the coming days and weeks. Talk to me about I think we've got an image of the front cover of your manifesto, the Tory manifesto for the last election. The first page saying that there'll be no rise in national insurance. There it is, circled for you right there. No rise in national insurance. That was a pledge from Boris Johnson. He signed it at the bottom. Are you increasing national insurance?
Well, I've read about the speculation this morning. That's not something I recognise. So, we'll see what happens in terms of the when we announce our details on social care, but which is what I think you're talking about. But that's not something I recognise. So,
how would you feel, given that it was a pledge from the Prime Minister, if there was an increase in national insurance? How should my viewers feel this morning about that?
Well, what I think your viewers will want is a solution for social care, and I think that's what
they'll want you to. They elected you on your manifesto, and you're going back on your manifesto pledge if you put up national insurance. So what I'm saying is, how do you feel that they would feel about that if you did?
Well, to be fair, Kate, I'm not going to get involved in speculation on a newspaper report. It's not something I recognise. But what we do want it to happen is to make sure that we can come up with a comprehensive programme to tackle social care. It's been around for a long time, this issue, and we really do need to get to grips with it. And that's what the Prime Minister and the Health Secretary are really determined to do.
OK. What's this that I'm reading about your boss saying he didn't believe the NHS would be overwhelmed during the pandemic last year? If he did say that, and if you did think that, why did you spend £500 million on Nightingale hospitals?
I'm assuming you're talking about the interviews with Dominic Cummings, which is something that will come out later. I mean, look, we were in this situation over the last 18 months when we've been living with COVID. We've been learning about COVID as has happened over the global pandemic. There are plenty of things that we've done to prepare, some of which we needed to the nth degree, some of which we didn't need as much. The Nightingale hospitals absolutely played a pivotal role. If you speak to anybody that was working in those Nightingale hospitals, the stuff that they saw, the stuff they had to deal with was horrific. And so it was right that we actually set up a lot to tackle something we really didn't know what we were facing.
The one in London was hardly used.
But nonetheless, the people that were there were actually, as I say, pretty in a horrendous condition. And so, having spoken to the guy in my local hospital that helped set it up, I've got first-hand experience or first-hand story of the sort of what he had to face, and it wasn't pretty. And
that wasn't a Nightingale hospital, though, was it? That wasn't a Nightingale hospital that you're talking about, there, was it?
Yes, it was. No, it was the Nightingale. It was the original Nightingale Hospital in the Excel Centre. So.
OK, so it was worth the £500 million that was spent on the Nightingale hospitals, despite your boss saying that the NHS would not be overwhelmed.
we've spent £407 billion trying to get the economy safe, trying to save people's lives, trying to make sure that we could keep the pressure as best we could off the NHS. Some of which we could have needed more. Some of which we may well have overspent because in terms of the fact that we didn't know what we were facing. It was right that we keep people safe. That's the first rule of any government. Keep people safe, and that's what we've been trying to do. That's what we'll continue to do.
OK. Is Spain going to be added to the Amber Watch list?
Those sort of decisions are taken at cabinet level. They'll look at the data and they'll make sure that they can work out what is best to make sure that we keep transmission of the virus low. We keep the transmission of the variants low, because it's the variants that are really key here to work out how they're interacting with our vaccine programme.
A lot of people who've gone on holiday to Spain will be watching us this morning in their hotel rooms before they go out for the day. He's talking about the data. The numbers in mainland France were 3 times lower than what they are in Spain at the moment. So does that mean that you're going to put them on the list or not? I mean, they'll want to know whether they need to book a flight home.
Yeah, look, it's not just about, we try and give people as much notice as we can, Kay, but it's not just about the pure numbers. It's also about the variants and the style of variants. The beta variant, for example, that's quite prevalent in France at the moment. We're looking about how that interacts with the AstraZeneca vaccine. And so there's a lot of factors that are involved in the decisions that are taken around travel. Comes back to the point that I was saying earlier. We've got to keep people safe, and we've got to make sure that we can keep on top of transmission. Carrying on with
travel, the US has put us, the UK, on the highest risk level. Do you think that's fair?
Well, again, they would take their decisions. I'm not going to comment on their decisions. I think what we've got to do is look at and have discussions with the US and other countries to make sure that we can keep as much open as possible. Because we've talked a lot about the UK, but you're right to look at travel, not just for holidays, although that's hugely important at this time of year, but to make sure that we can remain connected. That's good for the economy. It's good for actually getting that money in through the Treasury to cover the costs of the things that we've just been talking about.
OK, a final thought before I let you go. Cinderella has been canned, at least for now. When will Lord Lloyd Webber be able to open his new production?
Well, there's some productions that are opening this week. I know that, but I know how frustrating it is because with people getting pinged, and this is why we're trying to work through this. We're trying to make sure that we can keep people safe, but also make sure people can get back to work. I know really how frustrating it is because I'm the Minister for London as well, and I want to see London back as a vibrant community, a vibrant global city.
OK. Did you wear your mask at the Evening Standard party last night?
I wore my mask going in and out, but not in the party itself.